Dr. Rod here. Today we're going to talk in this video about how to use the wobble cushion, and specifically before your adjustment and at home. So here we go. When you come in to the office for your normal visit, we're going to start here with your traction. You're going to move from your traction, and we'll cover that in a separate video, to the wobble, from the wobble over to the adjusting. So we got the whole mix portion here, we got the fix that happens in here, and we got the set, and that's the vibe plate for after your adjustment. All right, so let's talk about the wobble. The wobble, I used to think that the wobble was not that great a deal, no big deal. And actually, this is something that everybody should do twice a day for the rest of your life. This helps improve flexibility, it helps to hydrate the disc, it helps to pump the cerebral spinal fluid and bring nutrients not only to the disc, but your spinal cord and the brain. It increases oxygen because it's a pumping motion to the diaphragm as well. There's so many things, but one thing that it's very helpful for new patients is to break up spinal adhesions from chronic subluxation and to soften the disc. See, over time with the subluxation and lack of motion, as we get older, right, doctors blame it on, well, it's just normal for you. No, we quit moving. And so we're going to do this cyclic loading and unloading, compression and traction to the spine, to actually change the pressure in the disc, to change the disc from a gel to more of a liquid so nutrients can pump in and out. Now when we're younger, we have a blood supply that does all of that. But yes, as we get older, that goes away. This is where activity is so important. And so this is a warm-up exercise for not only your adjustment, but to warm up to start your day. It's an awesome one to do before golf. I do it before workouts. Anytime, twice a day. So first thing I do when I walk in the door, guess what? Traction, wobble. All right, so first motion you're gonna do on the wobble cushion is gonna be side to side, lateral bending, okay? And what that's gonna look like is you bend to the side, this hip is gonna come up, that shoulder's gonna go down, then you do it to the other side. That hip comes up, shoulder goes down, hip down, shoulder up. So this is where the traction loading happens. This is where the compression happens. And you go back and forth. Now, very important that the head is moving with the entire body. This is a full spinal exercise. Don't leave your neck out. One of the most common mistakes we see patients make is that they don't get their head involved in it and they just tilt from side to side. Another thing that patients do is that they really don't get full bending in there. Now, when you initially start out, very important that this is within a pain-free range of motion. If it hurts, you need to let us know, and we need to adapt this for you. But eventually, it's not gonna, and this is gonna be the best thing you can do. So now let's do it full speed, and it should take about a second to go back and forth. There you go, that's perfect. She's getting everything in there. All right, number 2 exercise is going to be flexion extension, and you're going to look down to the floor, the hips get rocked together, and then all the way up and arch in the back. So what's happening is you get the traction on here, the compression here, and back down, we get the compression here and the traction here. So we're working all dimensions of the disc and the spine. Just like that. So full speed should take about a second. Now when you count these, you go from this to this, back to front, that's 1, okay? And so with your warm-ups here, you're gonna be doing 25, all ranges of motion, but at home, we're probably gonna have you do 60. Now, granted, this is the average for most people. This is the basic warm-up, and we may change it to fit your special circumstances and what you have going on with your x-ray. That's another reason why x-rays are so important. Now, the last one's going to be rotation. Arms are all the way up, and turn your head all the way to the right and rotate and do the same thing back this way, okay? And so we go from there, back is 1, 2, in about a second, and that's full speed. So some of the common mistakes we see is that patients don't get full range going, that they're not getting their neck involved, and on the side bending, what happens is the head starts to turn or the shoulders rotate like that, and we don't want that rotation. That's separate. That's going to happen on the rotation one only, and this one needs to be like that. Make sense? Okay, so lastly, what we want to make sure is this is a warm-up. This helps make the adjustments less painful, helps us to have a more complete adjustment to correct the subluxation. And so if a table's not available for you to lay down on, we want you to continue to be warming up rather, and you're going to just stay in that motion because we want you to go from this out of gravity to laying down. So here's another mistake people make. Don't leave here and go take care of something at the front desk. We'll take care of all that stuff before and after. Once we start this process, we want it to be continuous. Same thing after you get done with your adjustment. Very important that you go from the adjustment to the vibe plate, the set portion, right away, as soon as possible. So that's what we have for you on the Wobble cushion. Sorry. If you have any questions about that, please ask us, and we'll be happy to help you out. Have an awesome day.